A couple days after the surgery, I felt like I could do 30 sit-ups if I wanted to. I mean, I didn't have any restrictions on what I could do. I was out walking the dog. People were saying, "Didn't you just have surgery?" And I said, "Yeah, but I feel great."
We've developed something that gives patients a much better option to get back to work and to be able to move around with less pain and a faster recovery. That's DualPort.
DualPort is a groundbreaking procedure.
When I first went to a gynecologist, she had said that I wouldn't be a candidate for laparoscopic surgery, and I also went to a urogynecologist, and she said the same thing because my enlarged uterus and large fibroids. And when I went to see Dr. Deneliant, she was just very confident that she wouldn't have a problem to be able to perform the whole surgery laparoscopically.
DualPortGYN is really a fantastic approach to surgery. It's being used for fibroids, for endometriosis, and a variety of different things. It all has to do with the number of incisions and also the approach called retroperitoneal dissection. So with DualPort now we're using tiny incisions, just 2 5mm incisions only, cosmetically placed, and those incisions can do the exact same thing the robot can do, even better than a robot or a laparoscopic surgery. So now patients have the best possible option. Retroperitoneal dissection is sort of like a mapping system for the pelvis. If you're outside driving in your car, think about it. You use a GPS to find out where you're going. With that GPS, you can avoid accidents, you can avoid taking a wrong turn. You get someplace very quickly and safely with the GPS.
When standard laparoscopic and robotic surgeries are performed, the usual approach for both of these techniques is a blind method. Vital structures such as the ureters, large vessels, nerves, and parts of the bladder are not clearly seen. And this is especially important in complex surgeries such as large fibroids or endometriosis. The pelvis is not mapped out, resulting in increased risk of injury, complications, and bleeding. Mapping the pelvis through DualPort avoids injury to these vital structures and ensures that the surgery is completed quickly, safely, and without accidents.
The DualPort technique, with the combination of the 2 small incisions and the retroperitoneal dissection, really is a novel advance for hysterectomy and other surgeries. And because of that mapping system, the success rate is phenomenally high.
You're able to do surgeries that would otherwise not have been done in an outpatient setting or even done laparoscopically.
With DualPortGYN procedures, the uterus is generally removed through the vaginal defect through special techniques that allow for removal of even the largest fibroids.
We had one patient with a uterus that was just huge, really about this big, the size of a beach ball. It was 9,500 grams, almost 20 pounds in weight. There is no fibroid uterus this large removed on record, done minimally invasively. By approaching us and talking about a DualPort procedure for her, it really changed her life completely. She now had the ability after the surgery to go out into public, and she could wear different clothing sizes, be able to go out and swim and walk around, go to the park and hike and exercise. A completely life-changing operation for her.
None of the procedures performed by CIGC surgeons use paramorcellation for removal of fibroids from the uterus or removal of the uterus itself. It takes longer time to perform, it has more risks, and it can potentially spread cancer if the cancer is already present in the fibroid.
So now patients have the best possible option. Less pain, lower complications, and back to work much faster than any other approach.
And if you're told that you're not a candidate for minimum invasive surgery or laparoscopic, do a little bit more research, because I'm glad I did.
This is how people recover after that surgery. This is due to the technique being used, the skill of the surgeon, and the experience that we have.
And DualPortGYN allows patients to do that.
I still can't understand why every doctor doesn't switch to this kind of procedure, because it's so much better for women.
This is our answer to robotic surgery for all patients.